Okay, ma'am.
Yes, 5 seconds left. Do you people get to hear the bell? Okay, right. So if you have read and understood, considering it surgical or not station, kindly tell me what are you looking at?
I'm looking at a corner section of left knee, left
Right,
popliteal region.
right. It even says here.
Sorry,
Yes,
right.
yes.
Posterior surface.
All right.
Yes, ma'am, right.
Yes. Can you tell me how this popliteal fossa is formed? What are the boundaries of the popliteal fossa?
Above, it's formed medially by semimembranosus, semitendinosus,
Yes.
and below by medial head of gastrocnemius. And laterally above, it's formed by biceps femoris, and below by lateral head of gastrocnemius and um, uh, lateral head of gastrocnemius.
Yes. All right. Can you tell me what are the contents of the popliteal fossa from superficial to deep?
From superficial to deep, there are long saphenous vein. Then on deeper surface, from lateral to medial, common peroneal nerve, tibial nerve, popliteal artery, popliteal vein, popliteal artery, and other structures are posterior popliteal lymph nodes, posterior femoral cutaneous nerve, and descending branch, genicular branch of obturator nerve.
All right. Can you please identify number one over here in the
Number one, yes, ma'am.
yes.
Number one is the biceps femoris.
Okay. Can you tell me how many heads biceps femoris has and what are the attachments?
Yes, ma'am. There are short head and long head.
Yes.
Long head is from the ischial tuberosity, and short head originates from lateral border of linea aspera on femur.
And attachment, the other ends,
An insertion on fibula,
both
neck
heads.
of the femur. Yes, ma'am.
Okay. What is the nerve supply and action of biceps femoris, please?
Nerve supply is tibial nerve, and uh, action is combined with the other hamstring muscles. It acts for flexion of the knee joint and
Okay.
flexion of
Good.
the knee joint.
Can you please identify number 15, please?
Number 15 is the uh, mm, mm, number 15 is the tibial nerve.
Very good. This tibial nerve, as you could see, is dividing into, can you identify 17 and
What, ma'am?
this 15 tibial nerve is being divided, as you could
Tibial
see.
nerve.
Yes.
Yes,
In
ma'am. Yes.
division, what is this? These two branches, if you can identify, please.
This is the branch from tibial nerve to sural nerve,
Okay.
and
Can you, yes,
laterally branch from common peroneal nerve to sural nerve.
very good. Can you identify number 11, please? 11 here.
Number 11 is semimembranosus.
Very good. And if you can identify number 4 over here.
Number 4 is medial head of gastrocnemius.
Very good. Right. Can you tell me how the knee joint is formed?
Knee joint is formed by uh, knee joint formed by lower end of the femur and upper of the tibia and fibular head.
Okay. What are the movements which are possible at knee joint?
Flexion, extension, and mm, flexion, extension. No
Okay.
other movement.
What are the structures which contribute to the stability of the knee joint?
Other structures like their meniscus, um, the surrounding ligaments, anterocruciate, posterior cruciate ligaments,
Yes.
collateral ligaments,
Yes.
and the joint capsule
And
surrounding muscles.
yes, and bursa.
Bursa, there's some bursa. Yes.
Okay, if there is a swelling on the back of the knee or the in the popliteal region, what are the differential diagnoses that you'll think of?
The differential diagnoses are Baker's cyst, popliteal artery aneurysm, popliteal vein varicositis, maybe any kind of schwannoma or lipoma.
Okay, good. Can you tell me if you have to take the pulse of the popliteal artery, how would you do it? Can you demonstrate and show me?
I will first keep the patient on lying position and keep the knee joint flexed up to 90 degree, and I will hold the knee with both of my hold the knee joint with my ulnar three fingers
Yes.
of both hands,
Yes.
and
Yes.
I will feel the pulse by my three fingers of both hands. The above fingers will the ring finger will help to palpate the pulse.
Okay.
And I will keep ask the patient to relax his or her knee joint.
All right. Can you please tell me the course of common peroneal nerve?
Common peroneal nerve originates from sciatic nerve uh, just below the mm, at the popliteal area on the popliteal muscle, and it courses laterally, and it wings round around the popliteal neck of the fibula. Then comes in the lateral compartment. There's the peroneal compartment, and supplies the muscles of the lateral compartment.
So what are the branches? Does it give all the motor branches, or does it gives any sensory branch as well?
It gives the motor branches and sensory branch to sural nerve.
Yes, which supplies the posterior and lateral surface of the leg. Okay.
Posterolateral surface of leg.
What are the two motor branches, superficial and deep? These two motor branches supply which group of muscle?
This motor branches supply the lateral compartment muscles, the peroneus longus and brevis.
Just suppose a patient comes to you and you have to rule it out if patient's common peroneal nerve has been transected. How would you confirm it? What tests would you perform to confirm injury of the common peroneal nerve?
First, I will go, the loop will move approach, and the patient may come with an inverted uh, ankle joint.
Yes.
And if I ask the patient to invert the ankle joint, patient may not be able to perform that, and there may be loss of sensation on the posterolateral aspect of your part of leg. And
Yes. Good. Yes.
These are the sensory and motor deficits. And
Yes, with the patient will present with.
yes,
Okay. Right. How would you confirm if a patient presents with anterior cruciate injury, anterior cruciate ligaments rupture, or if patient presents with the injury?
anterior cruciate ligament rupture.
ACL.
In that case,
What would be the history that patient will tell you? What are the signs or symptoms you'll look for when you'll be examining the patient?
my patient may complain of locking his or her knee joint while standing, and
The the most important history, the thing that you'll hear in the history, patient will say, patient heard the popping sound and the joint became swell immediately. Patient would be in
Swelling.
immense pain, won't be able to go. Okay, last question, then we'll end. Can you please tell me the lymph nodes which are present in the popliteal fossa, where do they drain?
Popliteal lymph nodes drain in the inguinal lymph node, superficial and deep inguinal lymph node.
Okay. What about the ones which drain in the short venous vein, along the course of the short venous vein? Which lymph nodes are those?
The lymphatics along the short venous vein drains into the popliteal lymph nodes first.
Yes, good. And the popliteal one drains in the environment. Okay, good. Thank you.